I find that in general, when people come to you with a problem like head and neck cancer, it's something that's affected them deeply. There's a lot of challenges in head and neck cancer. I think the biggest one is just the effect that these cancers have on someone's function. It's a really exciting time right now in head and neck cancer treatment. We know that immunotherapy is likely to play a key role in the future treatment of these patients based on research done at WashU that's now matured over 10 years. We're lucky to have a really extensive head and neck research team. We have more funding among our head and neck research team than anywhere else in the country. But what we're most lucky to have is actually experts in many, many different domains of head and neck cancer research as well as treatment. And what this has allowed us to do is to actually bring different people with different training and background to put those ideas together, engage in team science that hopefully will ultimately lead to a cure for this disease. The funding from Pedal the Cause is more important than ever, especially in the current environment. The Pedal money really fills a critical need of allowing us to take those high-risk, high-reward, innovative steps with research. It allows us to not only continue the research, but to do it in a way that potentially is game-changing and to keep the necessary research moving forward without losing a step.
We were funded by Pedal the Cause 2 years ago for a clinical trial studying pyrimethamine in head and neck cancer patients. We screened over 35,000 drugs looking for a drug that may increase the responsiveness of head and neck cancer cells to radiation therapy. And by doing this, we found pyrimethamine, which is an anti-malarial drug. It's been around for a long time, but nobody's really studied it in the setting of cancer. And so far, we have a goal of enrolling 20 patients. We've enrolled 19, and of the ones that we've tested so far, we have a 100% success rate.
That came from a discovery in the lab by a graduate student, and we were all dancing, saying, "Oh my God, I can't believe this worked." So this first trial was just designed to ask the question, does the drug get into the tumor? And does the drug hit its target in the tumor? And the answer is a resounding yes on both accounts. The next step, or the next trial, will be, can we impact standard of care? The lungs and the highly oxygenated cells and your bladder, liver, breast cancer have reports in the literature for pathway activation, and it'll be exciting to see if this drug also works in those cancer types.
Based on our preliminary data and our clinical trial samples, we were able to adapt pyrimethamine into a new drug, which is even more potent. And based on this mechanism, we've applied for NIH funding and have received an NIH grant to fund the next phase of this research progress.
Without the Siteman investment program, without Pedal the Cause, without the support, there's no way this would have happened.
We need the funding from Pedal. We need people pushing for Pedal at every level of our community to keep the research going, to keep our advances in head and neck cancer going, and to keep Siteman and WashU as leaders in this space going. The way that Pedal is structured, where we sort of place smart bets on really interesting high-risk, high-reward ideas, and then those are matured through something like the Robert Ebert and Greg Stubblefield Head and Neck Tumor Center into a clinical trial concept or into a biomarker that could be used commercially, is really, in a way, how the synergism of these different things can happen.
Cancer is devastating. It's a real challenging diagnosis to hear, no matter what the prognosis is. And it's also really awful for loved ones having to witness their family members suffering. But what they can do is they can join Pedal the Cause. They can register, they can donate, they can ride, they can volunteer. They're truly making cancer research progress and gaining opportunities for clinical trials and really truly making a difference for patients.
Knowing that a dollar being given or raised or put into this process is being put to the best ideas in a community that's full of brilliant people who are hardworking and passionate about this idea of curing cancer is, in my view, probably the greatest thing that we can offer people who have either been struck by cancer or those that are trying to fight for those that have suffered from this disease.